Alright, so basically we are talking about the one of the confusing topic while you are doing the GMC registration, and everyone has been asking me. I'm really sorry for the late responses and everything because there were a lot in my plates. So yeah, finally we are here. So the first topic is the engagement in the medical practice, which is the most confusing area while you are doing the GMC registration. So what does that basically mean? So we will understand basically two terms while filling up the forms, and there were two terms, and I'll try to explain based off my knowledge. There are two terms, that is medical capacity and non-medical capacity. So what does that medical capacity means, and what does that medical non-medical capacity means? So medical capacity means any medical professionals are work directly in the clinical roles, and they are allowed to provide the direct patient care. The medical professional is registered with their local medical council or registration awarding body at that moment of the particular employment or particular job. So let's clear this confusion. Medical capacity means basically medical professional had a medical registration, registered with their local council, allowed to provide the direct patient care, and directly involving in the clinical roles like physicians, surgeons, specialists, non-specialists, whatever, but that they are allowed to provide the direct patient care, and registered with the local medical council, and they were practicing within the institution like the hospital, primary care, clinics, and so on. All right, so let's talk about the opposite one, the next one, that is non-medical capacity. So what does non-medical capacity means? So basically non-medical capacity means that medical professional at that particular moment were not involved in the direct patient care. Either they were under the supervision, or they were not allowed to provide the direct care to the patient. They probably might not have a registration at that particular moment while they were employed by the particular employer, and without having the medical registration, they were under the supervision of someone senior while they were providing the care. And that's about it. So non-medical capacity means not having the registration, or we're not allowed to provide the direct care to the patient at that particular moment, and the professional were not involved in the direct patient care, and rather they might involved in the non-clinical areas like healthcare, as well as medical education, and so on. So non-medical capacity either can be supervised, or we're not allowed to provide the direct patient care at that particular moment of your employment or job. Rest of the thing, it's quite revolved around that terminology, that is medical capacity and non-medical capacity. So research within the medical capacity, research having non-medical capacity. So these are the different posts with the medical capacity, or you had that post with not having a medical capacity. And other terminology are quite self-explanatory. So if it is a private medical practice, that's a private medical practice. If you are doing the private medical practice, you have to select that. If you were in the GP training post or the specialist post, you have to select that. The internship training post is quite self-explanatory, I would say. And at that particular date, if you were having observership or clinical attachment, just click on that, and keep in mind that whatever you are selecting, you were providing the genuine information, so that if National Medical Council asks you for the documentation to back up your information or verify your information, you should be able to provide the respective documentation to verify that all of these information are genuine. And if you are studying at that particular time, you can just select the study as well. So all of the other terms are self-explanatory. And with that, I believe this video is quite helpful to get things around and keep the GMC registration process keep rolling. Yeah, if you find this helpful, please subscribe, share with your friends. Thank you so much.